Welcome back. Now, tooth decay is a common problem that affects the hard outer layer of your teeth called enamel and can lead to cavities, pain and infection. Fillings, also known as restorations, are the main treatment option when decay has progressed beyond the earliest stage. To speak more elaborately on this topic, we're joined now by dentist Dr. Kagiso Moloi. Good evening, doctor. Welcome. Thank you for joining us.
Good morning and
Evening.
good evening. I'm used to having this interview in the morning.
Yeah.
Good evening and good evening to the viewer.
Thank you so much for being here, doctor. We've explained what tooth decay is, but can you further elaborate and also just touch on what actually causes a teeth to decay?
Okay. Here I've got 4 stages of tooth decay. The one that affects the pearly white, the white that we see when we smile. The one that affects the layer underneath, which is called the dentine, and the one that affects the pulp. The pulp is where you find your nerves and your blood vessels, and the one that affects the whole tooth, the whole pulp chamber, also affects the end of the tooth, and that's called periodontitis. Basically, what causes decay is the food that we eat. We eat carbohydrates, we eat sugary stuff, and that is consumed by the normal commensal bacteria in the mouth. Those bacteria release acids and they start eating up on the enamel. Enamel is one of the hardest substances you can ever find in a human body. When there's plane crashes or when there's a car accident where people are bent beyond repair, beyond recognition, what happens is they take the samples of the teeth and they go to their dentist and go look the matching x-rays so that they can be able to identify that this body belongs to Nina, this one belongs to Kagiso. So, but the enamel is so strong, the acid that eats up the enamel, it's so strong that it pokes a hole on it.
Yeah.
Yeah.
Of course, you mentioned diet, is one of the contributing factors, and we know that good diet is not only essential to your general health, but of course to good oral health as well.
Yeah.
And we know there's a saying that says one apple a day keeps the doctor away. But is that apple a day enough? What should a good healthy diet look like?
A good healthy diet should consist of veggies and your nuts, your carbohydrates. Even if you have sweets, make sure that you brush your teeth to remove that plaque, because that plaque, what happens to that plaque, it mixes with the saliva, it gets hardened to form what we call calculus. Calculus causes more problems, causes gingivitis and periodontitis. Basically, the normal tooth will be like that, and then dental caries will just affect the top part of it, and then when it's like that, when it has affected the pulp chamber, it's irreversible. So the only way is to do root canal treatment, where you remove all the pulp cavity contents, you clean them up, and you put some medicaments there, which are antibiotic in nature, and then you kill the bacteria, and then you put something called GP, catapeka, to take the space of where the nerves and the blood vessels were, and you close it up.
Yeah. You mentioned that there's 4 stages, before it gets to the very, very bad stage known as periodontitis.
Yes.
And how do you know, what are the signs and symptoms then of tooth beginning to decay? Because I think a lot of people don't come immediately when it's a problem.
When the tooth starts decaying, it will be just on the enamel, and when the person drinks something hot or cold, they feel it, but they ignore it, and then it goes into the dentine. Sometimes you can't ignore it when it goes into dentine, but when it goes into to the pulp, causing pulpitis, which is inflammation of the pulp. You can ignore it.
That's where the pain is.
That's where the pain is.
Right.
And the more you lie flat and the blood moves up, the more the pain you get. So usually the best thing is to sleep upright. Put the cushions at the back and sleep upright.
Sure.
The pain would be reduced. Yeah. And also take anti-inflammatories and analgesics to make sure that the pain goes away.
Yeah. Doctor, when you do a filling, and of course those are fillings right there,
Yeah.
do they even do the silver fillings anymore? They do the white ones now,
Yeah,
I see.
we've moved away from the silver ones. These are called amalgam fillings.
Mm-hmm.
Durability is 100%. They are very durable.
Yeah.
But they're not sightly. They don't look good.
Yeah, yeah, yeah.
Most old dentists still prefer that. Since I qualified 1999, I've never used any of that. I only use it at the university. I use white fillings, and then also we have temporary fillings if we feel that we are close to the nerve, but we don't want to do root canal treatment. To see whether we can still restore the tooth,
Right.
we put a temporary filling there, and after 6 weeks we can revert to the same tooth, remove the temporary filling and put the permanent filling. Also, we have something that is called fissure sealant. Fissure sealants are the ones that we put in at school. Children age 6, 7, we put sealants so that we prevent formation of any dental caries. Mm-hmm. And we also have caps for the children. We just put a cap if the tooth is badly damaged,
Right.
just to make sure that that tooth stays there until it's time for it to go by itself.
Okay.
Not to be removed.
Thank you,
the
doctor.
tooth, we actually want the tooth to go by itself.
Thank
and
you,
then
doctor.
we've got new technology where we prepare a tooth, take an impression, send it to the laboratory, and they make something that we cement
Sort of like
in.
a mold.
Yes.
That's awesome. And of course, all of this can be prevented by exercising good oral health. That is
Yeah.
brushing twice a day,
Yeah.
flossing, using a mouthwash, using a soft tooth bristle. And I learned all of that on my show.
Yeah.
Dr. Kagiso, thank you so much for joining us this evening, and thank you for your time.
It's always a pleasure.
When we come back, it's time for